Okay, so a number of things. One, I work in an environment that's diverse, right? We have, let's see, I mean, no less than maybe six nationalities represented. So I think that's the number one key is to have diversity. And what we do is we collaborate, right? There are cultures that I'm not ultra familiar with. So I reach out to a colleague, a friend, or a colleague of a colleague, or someone who works in our group to discuss, how I'm seeing this, what's going on, getting their perspective, right? They help me correct or fill in gaps in my cultural understanding for that particular culture. And so I think that's one of the biggest ways. The other thing is the intent. I'm aware of of the importance of a person's perspective, experience, and culture. And so if I'm going to help them effectively, my job is to enter into that ecosystem um, in a way that's biased as least as possible, with the intent to understand what their experience is. In doing that, I think a number of things happen. One, it builds trust with that individual. This is a person who's different from me, but is clearly hearing what I'm saying, understanding it, and able to relate that back to me. Um, and it's also very clear that when we have those sensitivities and we're communicating, it actually it brings a more rich conversation, a more detailed conversation, um, and we get more data around what's happening. And then the positive of that on the other end of that is that because of that clarity and that trust and that communication, our information is more complete, it's more accurate. That makes diagnoses more accurate. And then our likelihood of finding a treatment and an effective treatment in a shorter amount of time more likely. So the overall treatment experience um, is improved. And you'll get feedback from families. They'll say things like, "Okay, that person really gets it. I've seen five or six people, but they seem to understand." And I think what they're describing is an experience that's really focused on them and not the disorder. um, it's authentic in its intent to start with just understanding what's going on and who's here and what's important and what their experience is and what are they actually seeking support for, and then respecting those values in the discussion and the decision making process. And so um, I'm here as a collaborator to to share this information, help bring understanding, present options for intervention, and then let's talk about what's a good plan, right? And then even that is culturally sensitive as well, and culturally, I think, diverse. There's some cultures, both family culture, community culture, and then even with race and ethnicity, where um, and this is a bit more. I think you would see this more broadly many years ago than you do now, but that the physician is an authoritarian, right? And so in those families, they tend to rely more heavily on what the doctor says to do, which sounds pretty good, right? You're going to do what I recommend, and we can take advantage of that. But the other pieces that we have to understand is that sometimes then there may be more of a likelihood to say yes to something that you're not emotionally attached to and can support long term, or you're afraid to ask questions that seem to question my understanding, right? When I'm working with someone, I share with them how I see it, and I ask them, how does that match? How you is that? What parts of this are off, right? Because I'm not them, I don't live their lives, but that's how we get to that understanding. And sometimes families where they see the physician as the authoritarian, that's talking back or disrespect. And so I try to in those scenarios express the reason I'm asking is because I can't know. I want you to disagree if you aren't sure this doesn't match. We can talk it through. Some of those things, it might be that once we talk it through, you see where I'm coming from. And sometimes we'll talk it through and I'll say, oh, no, I had that wrong, or this is a better approach. And so that's the kind of dance, the flexibility that needs to be there, um, because it's not a one shoe fits all. But I do think that approach just creates an environment where whatever that path is, we're able to get to the destination. It just looks different each time.